feeling that there was something wrong with you, but everyone you told ignored you or didn't take you seriously? Or when you go to the doctor, they treat your symptoms like they're less than what they are, and they prescribe you with a quick and easy fix that doesn't seem to fix anything? Well, there are plenty of women who have been in that exact same situation time and time again. More women are facing serious medical issues that seem to be easily dismissed or prescribed with birth control as a quick and easy fix that tends to have more detrimental side effects than benefits. So today, I will be discussing the topics of the lack of studies on women's bodies, the misdiagnosis due to gender bias, and the medical mistreatment of women. First, we will discuss the lack of medical studies done on women's bodies. In medical studies, the typical test subject is a male body. And even though male bodies do need to be studied, women's bodies need to be studied just as much, considering women take up half the world's population. In an article by the Straits Times, author Stephanie Yao discusses how female and male bodies tend to present different symptoms for various health conditions. While a male going into cardiac arrest may show chest pain, a woman going into cardiac arrest will oftentimes show shortness of breath. This leads to medical professionals dismissing their symptom as an anxiety attack, leading to them going into cardiac arrest. On top of the fact that women's bodies are already not studied nearly enough, in the same article, author Stephanie Yao discusses how women will oftentimes ignore the symptoms that they are experiencing because of the stigma that they must take care of other people before they take care of themselves. This action does not only come from the stereotype that women are supposed to be caretakers, but also from the fear of being dismissed by medical professionals. Along with the stereotype of women needing to be caretakers, they are also held to the societal standard of looking prim and proper at all ages. Because of this standard, women oftentimes put their physical appearance above their health. They are taught they need to look a certain way, but they are not taught to take care of themselves. Author Stephanie Yao points out how the lack of studies and these societal standards leads to women developing eating disorders, deficiencies, and sometimes long-lasting health effects. Next, we will discuss misdiagnosis due to gender bias. Many women will deal with misdiagnosis because doctors tend to ignore symptoms and prescribe temporary fixes. Since a typical prescription for medical issues such as PCOS, endometriosis, or even acne is birth control, author Alyssa Goldberg points out how it disrupts hormones, further delaying a proper medical diagnosis in the article by USA Today. Many women have to visit several doctors before receiving proper treatment or a real diagnosis. Because of this, women tend to feel inclined to do their own research in hopes of finding a real diagnosis for themselves. Author Alyssa Goldberg talks about how a common misdiagnosis is when doctors will tell the patients that they are just overweight, when in reality, there are underlying issues such as PCOS. Going back to the issue of lack of medical studies on women's bodies and the issue of delay of proper diagnosis, these two combined can lead to detrimental long-term effects on women. For example, Goldberg explains how untreated PCOS can cause type 2 diabetes or even cardiovascular disease, which is the number one cause of death for women. Last, I will talk about the medical mistreatment of women. In an article by the Atlanta Journal, author Michael Scaturo talks about how both male and female doctors will brush off the symptoms of their female patients, saying it's not that bad, when in reality, conditions such as endometriosis or PCOS can lead to infertility. Because of this fear that women have of being mistreated, they tend to just avoid doctor's visits in total. As I stated earlier, sometimes it takes several hospital visits just to get one accurate diagnosis. Author Scaturo talks about how this creates an economic effect because it's taking women out of school or work. On top of medical misogyny, women of color have to put up with even more issues, dealing with more judgment but even less care. Scaturo states the statistic that shows the number of Black women who have died during childbirth is higher than the number of white women who have died during childbirth. Overall, the lack of medical studies done on women's bodies, the misdiagnosis due to gender bias, and the medical mistreatment of women is an issue that needs to be addressed more. Slowly, this topic is being more publicized and relevant, and I'm glad that I was able to bring light to it today. Thank you.